Implementing distress screening and psychological assessment in our clinics, especially in the Indian context. Good morning, everyone, and thank you for joining this important session on integrating psychological assessment into ART and IVF clinical practice. As we all know, the journey of infertility and assisted reproduction is not just a physical challenge, it's an emotional roller coaster filled with uncertainty, fear, pressure, and often unspoken grief.
By psychological assessment in IVF, research has shown that nearly 30 to 50% of individuals undergoing fertility treatment experience moderate to severe psychological distress. This distress, if left unaddressed, can impact hormonal balance, reduce IVF success rate, and lead to strained relationships, depression, and even dropouts from treatments of the cycle. Therefore, a structured and critically sensitive psychological screening protocol is essential, especially in Indian art clinics where stigma and silence around fertility are common.
Now, there is step-by-step processes are there which help implement psychological screening in art clinics. First, initial emotional screening, which is the first consultation. Tool which is used is PGI Health Questionnaire N2, which assesses neuroticism, somatic complaints, and psychological strain. Includes a lie score to detect defensive or socially desirable responses, which enables early identification of patients needing psychological support.
Second is well-being monitoring across IVF cycles. Tool used is PGI General Well-Being Scale, measures the overall sense of emotional health, optimism, sleep quality, self-worth, and stability, administered as baseline and post-IVF cycle to evaluate emotional outcomes and treatment. Helps track treatment-related emotional fatigue.
Third, deeper conflict and cognition mapping. Tool PGI Sentence Completion Test reveals subconscious thoughts, fears, and suppressed conflicts around infertility, gender roles, societal expectations, and partner dynamics. Especially helpful for individuals or couple-based counseling sessions.
Fourth is personality profiling for coping and resilience.
Tool used is PGI Personality Trait Inventory.
Provides a profile across traits such as emotional stability domains, anxiety, introvertism, extroversion, helps identify maladaptive patterns or strengths that influence treatment, adherence, and emotional well-being.
Fifth is belief and control mapping. Tool PGI Locus of Control Scale measures whether patients believe their infertility outcomes are controlled by internal actions or external fate or doctors or God. Crucial for customizing counseling language and intervention strategy. All of this integration into art workflow, how that happens. These assessments are not meant to delay treatment but to support it. Most of these tools take 10 to 15 minutes to administer and can be integrated during intake, nurse assessments, or while waiting for blood work or sonography. Counselors and trained staff can score the tools and flag high-risk cases for psychological intervention. For complex profiles, psychotherapeutic methods such as subconscious energy healing therapy, CBT, relaxation, or couple therapy can be provided.
Benefits for patients and clinics: improves emotional readiness for IVF, reduces dropout rates, enhances marital adjustments and patient satisfaction, supports ethical and holistic care products, meets guidelines of ISAR, ICMR, and WHO for mental health integration in fertility care.
Yeah. So infertility is a deeply personal pain, but through early emotional screening and Indian culture rooted psychological tools,